So we all know about the relationship between the skin and the gut. We know that each of them influences each other. There is a bi-directional connection between the two, but how? And when do we know we're on the right track or not? So today, me, Dr. Amee, a dermatologist, and Dr. Rithu, who is a nutritionist and a wellness specialist, is going to talk about this and help each other understand our organs and then help you in effect. Skin and gut are very important for not just each other's health, but also the health of the entire body, including our mental health and our immune system. So let's actually dissect each part of it and understand its interrelationship. Today, I want to begin with the gut microbiome. So I just want to know, Dr. Rithu, that how does the gut microbiome affect the skin and the entire body?
That's a very good question, Amee, and the basic one. See, what happens is that gut microbiome and the skin microbiome, they are related to each other. Okay, as you said, it is the largest integumentary system in the body. So it has a huge surface area, and through the surface area, the absorption happens. So whatever gut absorbs affects the skin, and whatever we eat affects the gut. So that's how the two are connected to each other.
So like Dr. Rithu said about gut microbiome, what is this microbiome? Microbiomes are a collection of good bacteria, fungi as well as viruses that play an essential role in maintaining health of our body, including the skin and the gut. But when this microbiome is altered, doctor, how does it affect our gut and then thereby of course the skin?
Okay, see Amee, what happens is usually gut microbiome we have seen in case of intestinal diseases, like inflammatory bowel disease or Crohn's disease or ulcerative colitis. These diseases we have seen that when the intestines get affected, they show up on the skin as well. So that is a true connection where we see that both gets affected. And what happens in these diseases is you end up having maybe you'll have some psoriasis issues, or you'll have eczema, or you'll have maybe dry hands, and then sunburns happen. So all these things get affected when people are getting intestinal problems. So that's how we have seen a connection between gut microbiome affecting the skin health.
Which is right, because whenever we take history for diseases like psoriasis, eczemas, which are chronic long-term, right, we always ask about medical history in which we cover the intestinal issues in details, right from acidity to, irritable bowel, where there is constant diarrhea, or maybe a shifting between constipation and diarrhea. So generally we do ask this, and it's extremely important that whenever we look at a chronic skin condition, it's very important to cover history of everything, because skin is the largest organ of the body. Sometimes we just look at skin as if it's a separate thing and the organs are different, but it isn't. It is as dynamic as your heart or your liver or your lung, and it gets affected by the internal changes. So it's extremely important that we understand the connection between the two. The other thing that I see, Dr. Rithu, in my patients is that acne. Initially we used to think that acne was only up to the age of teens, where, the hormonal imbalance settles, and by 20-25, you're rid of your acne for life. But now we're noticing acne sometimes spurting in your early or late 30s, sometimes all the way up to 50 years of age. And that's very alarming, It sometimes affects a lot of your self-confidence and, your self-esteem, because acne is visible on the face and visible to the entire world. And now with COVID coming in, we're noticing a lot of Zoom calls and, where you are right there in close-up, seen on a screen. It affects our patients a lot. So can you tell us that is there any gut relation with this, and, how exactly our patients can benefit with a good diet and healthy lifestyle?
As you rightly pointed out, Amee, see what happens is when we are young, we have a different intake of food. When we age, we are not aware that our diet is supposed to change along with our aging process. Usually what happens is our absorption capacity decreases. The hormones, the way they function, it changes. So along with age, that's what I tell my clients, that you have to change your diet, and that becomes even more important when you're aging, because there are hormonal changes that are happening in the body and you have to go with it. Plus what happens is, usually when we are young, we exercise, we are more active. When we age, we become less active. Sarcopenia sets in, as early as 30, 35, sarcopenia starts setting in. So our muscles have reduced capacity to absorb and perform, and entire thing will affect your body. So diet there becomes very, very important. See, if you're taking in food that is high in sugars, high in fat, that will have a direct effect on the gut microbiome. The kind of bacterial species that happens with high fiber diet and the kind of bacterial species that comes with high sugar diet is completely different. And when we have food that is high in sugar, we tend to have more inflammation, and that usually, I tell my patients that when you have something rich in sugar, you kind of feel itchiness in your throat. You tend to get even sore throat more often if you're having high sugar items. That is a direct indication that sugar leads to inflammation. So if you want to cut down the inflammation, if you have to change the kind of microbiome to good microbiome in your body, sugar needs to be reduced. And same is true with high fat also.
That's so rightly put, Dr. Rithu, because all my adult acne patients, even before I treat them, I tell them that this is a manifestation of your lifestyle. So it's very important to understand to curb down sugar, because sugar leads to inflammation, as you rightly said, and that inflammation comes out as acne. Again, as you said, hormonal imbalances that happen because of the diet. And you typically notice adult acne in the lower part of your face, that is the jawline and the upper neck. So these two are so connected. And as we age, we need to change our diet to help reduce inflammation. But how do we do that? Let's discuss that now.
That's true. Actually, you know what? Inflammation in our system is at an all-time high. And diet directly affects the inflammation that we have in the system. But the good thing is that if you are aware, and that's what our intention is today, to make you aware, you can reduce the inflammation in the body by having the correct diet. And we are going to talk about important factors which affect the microbiome, and those are the prebiotic, the probiotic, and the postbiotic.
Yeah, there are so many supplements now available and so much of knowledge going on social media that sometimes when patients directly come and ask us, you realize that I feel ignorance is bliss. When you have half-baked knowledge is when you make the wrong choices, and you kind of get lured by just marketing gimmicks, So it's so important that we as doctors explain to our patients about what is this right diet, and it's so simple. You don't even have to take supplements for it. In especially our Indian diet, it's all included. It's such a simple thing. Like prebiotics. Doc, tell us about prebiotics. How and why should we include it in our diet?
See, as the name indicates, a prebiotic. Pre means what? It is helping the biome to grow. So these are the fibers. The fiber which is present in our fruits and vegetables, in our oat bran, in the wheat bran. All this fiber will help the biota to grow properly, because these biota, they feed on this fiber and they convert it to various essential compounds which have a very, very healing effect upon the body.
That's right. So, like vitamins, minerals, vitamin B12, vitamin A, C, it's so important for our gut, but it's important that it gets absorbed from the gut. And this can happen, as you very rightly said, by eating or consuming the right fiber. So prebiotics essentially do not get digested. They are only food for the microbiome. They feed the bacteria, the fungi, the viruses, which then as a byproduct release the vitamins and minerals which get absorbed into the body and help our system. So it's so important to eat right. You may not need your supplements of B12 and vitamin C that you generally consume.
True. And you have to have a diversity in your diet. When you're including fruits and vegetables, you have to go for a diverse range, because the more diverse it is, the more diverse will be your gut microbiota, which is going to affect your health.
That's so true, which is why in India we have the Thali or the meal system, where we include everything in the right proportion and all together. So we don't have just one part, okay, only eat fruits or only eat vegetables and then leave the rest, It's so important to go back to our basics and eat what our grandmothers used to eat with the right proportion. So neither is fat bad and nor is protein extremely essential, because anything not in the balanced proportion is going to harm the body. That's true, right?
Yes.
So it's very essential. And here I think we need to talk about the probiotics, because these are the actual food supplements and food things that you can eat to increase the microbiome itself. So Doc, tell us about probiotics.
Yeah, probiotics is very important, and these days there is a craze about probiotics. So I would like to make you more aware on this, because rather than going for something which is having certain species of bacteria and you feel that you can have it, like kombucha is there, kefir is there, people are like just going after this, but do you actually know in preparation of kombucha how much sugar they are using in that? So that is not going to help you. In fact, what can actually help you is a simple curd which you're setting at home. Okay, so home set curd is what can be a very good probiotic. You can leave rice for fermentation overnight. You can put water in that, leave it for fermentation. You can have it in the morning, the first thing. That is an excellent probiotic. So these things which are home fermented, in the north we use a drink called kanji, which is made from black carrots. That's an excellent probiotic, because there was a paper which I've gone through, on that, where it is saying that even menopausal women, they get, benefited from consuming kanji. So it is that good a probiotic. So we actually have to go for these traditional probiotics rather than run after the probiotics which are available in the market.
I totally agree. Like, if you look in South India, we have for breakfast, idlis and dosas, which are essentially just fermented rice and dal. So, just by skipping breakfast, or probably by eating the very, trendy oats and, cornflakes and other things is not going to actually add on to it. But early morning eating a breakfast of idli or dosas is going to give you the microbiome that you need for the entire day. So it's such a simple thing, and sometimes we forget these things, I think that is extremely essential. And simple recipes, I still remember, like when a child is about 6 months plus, they give the rice water, where we boil the rice extra, and the superficial water that comes we give them. And as you rightly said, kanji, that kanji rice water we give to infants just to help their microbiomes. So it's so important that we go back to our basics. I think that's the conclusion, right?
Very true.
Yeah. So diet essentially is extremely important, and once the microbiome is right in the gut, the microbiome is right in your skin too, because it's directly related. So diseases like eczemas, dermatitis, acne, all these things, even rosacea, can be kept under control just by eating the right food. So here today, Dr. Rithu and I are sitting here to just make this point very clear to all of you. Eat right to look bright and stay healthy. Hi and welcome today. And today we are going to talk about our Indian Thali or meals, and do they actually make sense in today's world? I am Dr. Amee. I'm a dermatologist, and welcoming Dr. Rithu. She is our nutritionist and wellness specialist. And today we're going to delineate about the Indian Thali and its importance in today's world. So Dr. Rithu.
Amee, a thali is absolutely important. And when we talk about balanced diet, most people, they don't understand the concept of a balanced diet. But when you go back to your traditional thali, you have it right in front of you. Where you have a vegetable, you have a curry, you have, dal, you have curd, you have buttermilk, and you have chapati or rice, traditionally, whatever is your background. And then you have salad also on the side. So this is what a balanced diet is made up of, in all the right proportions which you find it on your thali.
So today's world, people talk about the pre and the probiotics, and they start taking supplements because they feel they're deficient in all of this, and very rightly, because they don't follow the right, balanced diet. And then they start noticing conditions like an irritable bowel syndrome, or they have eczema, adult acne. So I think somewhere going back to the basics to this thali is very important. But I think in today's world, we need to link with the the terminologies which are happening now with our thali. So let's talk about the so-called pre, pro and postbiotics and how we can include that in our traditional thali.
Rightly said. These prebiotics, postbiotic is something which is formed after the biota performs, and the probiotic, this is all present in our thali, and you can find the curd, the buttermilk, these are the probiotics. The prebiotic would be your salad, the grains that you include, the wheat bran if it is there, your whole wheat chapati, all this will lead to your prebiotics.
Yes, and the post, of course, is what the probiotics actually end up as a byproduct. So you get your vitamins, you get your minerals, which can then get absorbed into your body and protect your skin, gut, as well as maintain your health.
And you know what? People these days, they complain a lot about they are not able to sleep properly. But if you are consuming a balanced meal in terms of your traditional thali, you would be getting everything, because these will help your gut microbiota to be happy, and they will be producing the neurotransmitters, the dopamine, the serotonin, which will help you to sleep better.
Absolutely. So I hope we've been able to delineate the entire concept of our thali with the pre, post and probiotic syndrome that is there in today's world. I just hope this helps each one of you, all age groups, right from mums to teenagers to our elderly population, just for them to feel good that yes, what I eat is right. Thank you, Dr. Rithu, today for coming here, and I think we should have many more such discussions to speak about so many things, because we both deal with organs which are interrelated. So wonderful to have you here, and let's hope we do this once again.
Thank you, Dr. Amee, for having me here for this session.